Nepal is witnessing a health staff crisis amidst rising infections in the hospitals. Driven by the Omicron variant, the caseload has increased by 10 times in the first 3 weeks of this month, and many healthcare workers and doctors have contracted the infection. Previous waves had strained the health system of the country, and there are apprehensions that this wave too can deal a heavy blow. The government has several measures to contain the spread, but that hasn't proved effective enough in flattening the curve in past few days.
As the third wave of COVID-19 rages across Nepal, the capital city of Kathmandu is witnessing long queues of frontline workers getting themselves tested for the infection. Over 500 doctors and healthcare workers have contracted the infection in just 1 week, putting a further strain on the health system of the country. In view of these infections causing staff crunch at hospitals, the government has reduced the isolation period to 5 days. Many others have been isolated at home in order to provide more admission space to common citizens.
I think this third wave is going to bring human resources cry a lot, because a lot of healthcare workers are getting infected day by day. If you look into the data, bigger hospitals of Nepal like Bir Hospital, teaching hospital, more than hundreds of healthcare workers are getting infected. So once they have to go for isolations, we will not be having adequate amount of healthcare workers to take care of the patients.
Some regional and district hospitals outside Kathmandu Valley too have been hit hard by the infection amongst healthcare workers. Many districts have reportedly been forced to shut operations partially thanks to the limited staff after most of them contracted COVID. The Bharatpur Hospital in Chitwan district, considered as one of the prime locations hosting large number of doctors and medical students, has also isolated majority of its staff. In Nepal, even before the COVID pandemic, the number of human resources stood very less against the population. When the country's population stood at 1 million, there were only 1,300 doctors in the country, and despite a threefold increase in the population, the number of doctors remains the same.
In Nepal, even when there was not COVID, the number of human resources were very less as per the population. Even if you look into the government side, when the population of Nepal was 1 crore, we only had 1,300 doctors in government sides. And when the population of Nepal was 3 crore, when the Nepal population is 3 crore right now, the number of doctors of government doctors are only 1,300. So there is no increment in the number of doctors in the government side. So now during COVID, the gap between the populations and these doctors has increased more, because people are getting infected more and more, and we have the same number of human resources.
The current positivity rate of the country is at grim 45%, and Kathmandu doesn't seem to have a contingency plan if the physicians are hit even harder in coming times. In such a scenario, it is not left with many options but to follow the standard protocol of containing the spread: the lockdowns, immunization, and now the booster doses. Its economy was severely hit last time around, and the daily infection graph seems to suggest a repeat of the same in coming weeks.